Hi everyone, Matt and Naomi here from Active Therapy South. We are going to show you a little technique that you can use anytime, but after exercise it's definitely going to increase your stretch capacity. So it's a really clever way to get the most out of your routine post-exercise or anytime. So I'm going to hand over to Matt.
Hello, Matt here. As Naomi said, this technique is fantastic for increasing your effectiveness with your stretching. A lot of you out there will be absolutely going crazy with the HIIT workouts, everything designed to contract the muscle. If it's anything like normal days, normal daily living, that's what a lot of people do. They'll go and do a HIIT class, they'll kind of shake their arms, shake their legs a little bit, do a little bit of stretching and off they go. Sat at a desk all day. You're sat at home at a desk all day, then doing exercise, and I guarantee that 75–80% of people out there probably won't be stretching enough. If you put this little 5-minute routine into your exercise, so you finish your class and you do this little routine, you'll get 2 or 3 more times effectiveness out of your stretching. I'm going to show you right now upper body. We've done another video for lower body. What I suggest is you have a little look at both and pick the exercises, pick the areas that cause you the most trouble with regards to tension, because this technique can work for any muscle. Okay, so it's called a muscle energy technique, and it's designed to put counter pressure through the stretch to allow you to then extend the stretch further, and I'll show you how it goes. Okay, so the main areas of the upper body are the scapula, the chest, the triceps, the trapezius, and the left scap, which goes up into the neck. So I'm going to show you those, but have a little think about it. Like I say, you can apply it to any muscle. So I'm going to demo these. Right, first of all, scapula. So you bring your arm across to the point of bite. Now that point of bite is where you start to feel the stretch pain. Doesn't have to be much, 2 or 3 out of 10. You bring it across, you see where my elbow is, and then you stop. What you do then is you counter press. So this arm that I'm stretching this way pushes back into the other arm, and it stabilizes it. You should only push 30% of your maximum ability. 100%, you're going to pull your arms across. 30%, this arm is then able to keep it in position. So push into that arm, and this is the stabilizer. I can feel that stretch pain now starting to reduce. You do this for 10 seconds. 3, 2, 1. Only relax this arm, and you'll see that it'll go further. Back up to the point of bite. Push into the arm. Make sure this arm stabilizes it, as I've said. 10 seconds. 3, 2, 1. Relax the stretching arm and bring it across again. You can do this 3 times on each side, and then we move on to the chest. Okay, so what I want you to do with regards to the chest, pec minor, pec major. Start with the pec major. So the lower the arm, the higher the pec. So we start up here, we push into the doorway. Okay, that's starting to feel tight. Now the counter pressure here comes by pushing back into the door. The door isn't going to move. So you push in 30%, 10 seconds, 3, 2, 1, relax, and you'll be able to push that a little bit further. What's happening here is we're turning the stretch receptors off. When you turn them back on again by relaxing the muscle, you've got about 2 seconds to allow yourself to push that stretch up to the level of the discomfort that you felt the first time, but hence being able to go that little bit further. It takes half the time as a normal static stretch and is 2 or 3 times more effective in lengthening the muscle, okay? So that's the pec. Again, 3 times, remember. So what I'm going to do now is just show you once. It's a good point, actually. I'm just thinking, I did say the pec minor and the pec major. We start here 3 times, then we move down 2 inches. Okay, thank you for that, Naomi. Then we move down 2 inches and do the same 3 times. Move down 2 inches, same 3 times. Okay. Right, now we want to release the trapezius, the tricep. So we'll do this by doing exactly the same as every other one I've shown you so far. We bring the muscle to the point of bite. I'm not going to go through it 3 times each time. I'm just going to do it the once and show you the basics of the exercise, basics of the stretch. So we bring it to the point of bite, push into the stabilizing hand, this one. 10 seconds, 3, 2, 1. Then we can bring it down a little bit further, okay? So that's the tricep. Now the trapezius muscle. Basically, bring your head over to one side, again, to the point of bite. Then we use this as a stabilizing hand and counter press. 30% of your maximum. 3, 2, 1, relax. And you'll go a little bit further, okay? Again, 3 times, both sides. If you find, for example, that your right shoulder is always the tighter one, do the tighter one first. That'll give you an indication of how far you're able to go with that one, and then marry up the other side to it. So you may only do 1 or 2 counter presses on the left side if the right one is naturally tighter. Really important point, we're trying to get balance in this situation, okay? And the final one is the left scap. So it's the muscle that attaches from the spine of the scapula here up into the neck. Sometimes gives you headaches, definitely one for desk workers. So what you do with this one is turn your head to the left, bring your head down, stabilising hand, point of bite, head into the back of the hand. This arm keeps it steady. 3, 2, 1, relax. You'll be able to bring it further. Don't overstretch. Remember the blue tack thing, I mentioned it in a couple of the other videos. Take a piece of blue tack out of a packet, pull it, it'll snap. The fact is with this, if you're doing it after exercise, your muscles are going to be warm, so you can crack straight on. If you're doing this as a therapeutic stretch, you should always make sure you refer to our initial video for ergonomics about releasing the neck and shoulders, because that will warm up the tissues first, and then you can specifically focus on any particular area of extra tension. Next.